y'all. It is Ashley Frasca in for Dr. Bruce Feinberg, hosting the weekly checkup today, brought to you by Viral Solutions. And I've got in studio with me Dr. Donovan Christie of ANWAN Regenerative Center. You've been on the show before. You've spoken for QC Kinetics. ANWAN Regenerative Center, that's your baby. That's all you.
Yeah, that's my lifestyle educational practice. You know, we look at it as a wellness center because I think it's very important for physicians to accept that major role of educating patients on lifestyle modifications and not just pushing drugs, because we can always treat a disease. We have enough pharmaceuticals out there to treat disease. But treating a disease doesn't necessarily cure the disease.
Well, pharmaceuticals, in some cases, if not properly prescribed, are just kind of masking still what may be a symptom that still exists, that maybe could be manageable.
And many of them have side effects, right? So the side effects sometimes could slow down your metabolism and actually increase the risk of obesity. So it's important. If you have high blood pressure, if you have diabetes, these are things that can be reversed with lifestyle in most people. I'm not saying 100%, but in most people. Getting to that healthy weight is primary.
And at what point in your career and your studies did you decide that wellness was something that you really wanted to focus on and people achieving overall health? You know a lot about it.
Yeah, I think I got out of residency, I was 30, and then by the time I was 38, myself, I got into the grind and working. I put on weight. I put on about 30, 35 pounds.
In your 30s?
Yeah, in my 30s. And I developed borderline hypertension and, just sluggish, just going through the motion, not really paying particular attention to my diet, drinking a cocktail or two a few times a week. That contributes to weight gain. And not managing the stress. Because when you're stressed, and this is a big thing, especially women when they're stressed will eat sugar.
Sounds familiar.
There's a craving that develops when the stress hormone goes up, cortisol, and it makes you want to get sugar in the body. It makes you want to get salt in the body just by being stressed. So we have to find effective ways of dealing with stress so that we don't get these cravings.
Definitely want to talk more about your attitude towards all of that. But in talking about the obesity epidemic, right? You've seen a number of patients come through. You see it in our day-to-day lives. People maybe just don't take the time to take care of themselves. So what is ANWAN Wellness Medical Center's answer to the obesity epidemic? What do you have to offer folks?
Yeah, so in 30 years of practice, I developed this program about 3 years ago. It's called the 12 Weeks to Wellness program. And it's a program, I don't consider it a diet. I consider it a lifestyle modification program. Basically teaching people the three components: how to eat right, nutrition, how to get the proper activity, and how to manage your stress. So the first and the most important part to this program is the coaching. Now, I lead a Zoom session once a week for an hour where patients who are enrolled in the program, it's free. They hear me and I talk about different topics. I teach them about food. I teach them the nutritional value of food. I teach them so they know exactly what food is good for the body. How do you give your body good fuel? And what to stay away from, because nobody's telling them, don't eat these foods, right?
The label on the grocery store shelf, if the price is low enough, that's kind of what you congregate to.
And it tastes good because they've put enough things in it for you to love that taste and to create that craving. Really, especially most fast foods, they have chemicals in it that makes you crave it.
Really?
Yeah, if you drive by certain fast food restaurants, just by seeing it, there's a lot of research involved with this. So people just get, you want to eat healthy, you're on a diet, you're eating fruits and vegetables, and then you drive by your favorite fast food restaurant. Next thing you know, you find that you're turning into the parking lot through the drive-through window to go pick up something that's not on your program. So you just have to be aware of all the traps out there. because it's easy to fall off. So the coaching is extremely important.
Well, that's really good, too, that patients kind of have that interaction with one another if they log on to the Zoom call and you're giving them further education. But what does week 1 look like when you sign up for the 12 Weeks to Wellness?
Great question. The first week is a detoxification week. Okay, so we have so many toxins that we're exposed to, right? There's a lot of chemicals that are in our foods, pesticides, there's herbicides on the plants that we're eating. There are hormones, there are antibiotics in the meats that we're eating. So we need a good detox. Many of us are on medication. These medications are ingested. They have to go through the liver. The liver is a primary detoxification organ in the body. It gets overwhelmed because of all the things that we're experiencing in our day-to-day lives. So a detoxification is when we are cleansing the liver, we're cleansing the kidneys, we're cleansing the GI tract. We're pulling the toxins, the heavy metal from our fat out so we can get it out of our bodies. We've now tuned up our bodies. It's like spring training, where you're getting in shape so that you can truly have a good season, right? So now we're going to start proper eating for the next 11 weeks. So the detox we use is called Core Restore. It's a 7-day detox. The first 2 days basically is a fast. And we can talk about the benefits of fasting, but when you force the body to utilize the energies that you have in the body in the form of fat, and you're resting your GI tract, you're resting it so it can actually do its job, right, which is to weed out what's needed to go in the body and what doesn't need to go in the body. That's when you're pulling out the energies that you're using to digest food is now used to pull out toxins out of the body. There's a smoothie that you drink twice a day, and then there's 2 sets of pills, some multivitamins and minerals that you're taking. And if you're drinking plenty of water to flush your system, we recommend at least a gallon of water per day. And you can drink teas, herbal teas. You can't have caffeine for that week. It's not recommended, but if you have to, some people, they can't do anything for a week.
Yeah, like without caffeine,
they get headaches. Yeah. But, after 24 hours, maybe 48 hours, your body is fine. You just keep flushing it, because it's really more of a dehydration while you get the headache. So you just got to keep drinking and drinking. You can do fruit juices for that week. And then, so the first 2 days are like that. The last 5 days, you're eating one good meal. And the book that comes with the detox kit, it tells you these are the good foods you can eat. These don't produce inflammation. And these are the foods that you shouldn't eat. What do you think would be on that list that you shouldn't eat?
Oh, there's probably more on what you shouldn't than what you should.
Well, primarily, actually, you don't want to eat gluten, right? Because I mentioned before it's a sticky protein. Not even the organic. We just don't want you to have any gluten for that week. We don't want you to have any soy-based products for that week. 99% of the soy products in this country is GMO anyway, so we don't want soy. Those 2 are very allergic. They're harder to break down. We want you to stay away from fish because of the heavy metals in fish. We don't want to put anything else in, and especially if it's wild-caught, farm-raised, we don't want any of that, right? So no fish. Certain fruits are not good for detoxification. What do you think that would be? Oranges?
Something acidic?
Acidic fruits, grapefruits. We don't want you to have those. Pineapple. But you can have the berries. Berries contribute to detoxification. Blackberries, blueberries, strawberries. Eat those. Bananas. You can have those during the detox. And you can have grass-fed beef. You can have organic chicken without antibiotics. And you get through the week. You have one meal in the day. You drink your smoothie in the morning, your smoothie in the evening. Most people, this is how you start this. Your stool changes, the color changes. and you're just getting rid of everything. You tell by the consistency of your stool and how it floats, and when you defecate. So you pull that out, and then your energy level by about day 4, day 5 just shoots through the roof. You're taking these pills morning and evening. You're drinking the smoothie morning and evening. And most people will lose between 5 and 10 pounds, but it's primarily waist.
Wow.
Yeah. And then you get into the full eating program for the 12 weeks program. But that first week is crucial to getting your body ready for weight loss. Now you're primed to your body. Your body says, okay, I have all this extra energy, because that's all fat is extra energy with inflammatory cytokines in it. So we want to get rid of it. We want to reduce our body fat. A healthy body fat percent for a woman would be somewhere around 24 to 27%. For a man, we want him to be between 18 and 24%. Now, the athletes will have body fat of 6%, 10%. But to be healthy, 18 for men, 24 for women. You can ward off most conditions, most of the chronic conditions that I'm talking about. High blood pressure, diabetes, liver disease, heart disease, hyperlipidemia, high cholesterol, just by losing that body fat.
So you hear Dr. Donovan Christie of ANWAN Regenerative Center and ANWAN Wellness Medical Center talking about this 12 Weeks to Wellness program. If you can make it through the first week, it's like boot camp. If you can make it through the first week and you're committed to this, you're going to start to feel better. Your body's going to treat you a little bit better. Want to know more about fasting, Dr. Christie? I do have some questions about that, as well as what lab work may be involved and how you actually get to know the patient and their chart prior to the completion of the 12 weeks. So stay tuned to hear more from Dr. Christie. And this is Ashley Frasca hosting the Weekly Checkup on a beautiful Sunday. You're listening to WSB. All right, it's the Weekly Checkup brought to you by Viral Solutions. I'm Ashley Frasca. I've got Dr. Donovan Christie of ANWAN Regenerative Center located in Tucker. There's a Wellness Medical Center located in Hapeville as well, talking about the 12 Weeks to Wellness. Dr. Christie, you've worked with a ton of patients on this. Your coaching and the workbook with the nutritional program are free in this 12 Weeks to Wellness program.
Yes, it is.
What does an initial consultation look like for someone coming to the office for the first time and saying, I've got 12 weeks, sign me up?
Yes. So the quickest way to sign up is to go to the website, which is ANWANwellness.com. That's ANWAN, wellness.com. Once they sign up, they basically put their name and email address. Then we email them. Yes,
right as I go to the website. There it is right there. Sign up now. It's a banner kind of poster for the 12 Weeks to Wellness program.
Yeah, a landing page, yeah. And that works. And then they could make an appointment to come in, because it's a good thing to come in and establish care for that. You don't have to come beyond that one time. We do a body impedance analysis. And what that is a body composition test. You want to know, not just a BMI. You want to know.
This sounds a little more involved.
Yeah, you want to know how much fat you have to lose, not how much weight. Because weight, you can be 250 pounds and you can have a body fat percentage of 10%.
Yeah, if you have muscle, you're
if
not
you
going
have muscle,
you don't
exactly.
lose that.
So there's a difference versus being 250 and your body fat percentage is 45%. And, we have a lot of people come in with that. Some of them over 50%. And they leave a little dejected because they say, oh, my God, half of my body is fat, right? And you're like, well, we can work on that.
Yeah, of course.
Right? So never get dejected with the news, but you have to know where you are. So a BIA will give you your weight. It will give you how much of your weight is fat, what your fat mass is, and the percent of body weight. It'll give you your water weight, which is important, your total body water weight.
Does that fluctuate?
Yes, it does. But you have an intracellular water and you have an extracellular water. You want most of the water, 60% of it should be inside the cell, because this way you get better exchange of nutrients in and out of the cell. If it's outside the cell, that's when people get edema and swelling. We don't want it outside the cell. We want it inside the cell. This test tells us, so we know. And then lastly, it gives you your bone mass and your muscle mass. So you get a good idea of what your composition is. We try to build muscle, and we burn fat is the goal.
Perfect. I love that. So that's easy enough. Any needles involved for anybody that's a little sticky to
No needles involved with that. But the fat loss aids, which I'm going to talk about later, if you want the fat burner injections or semaglutide or you can do phentermine as well under physician guidance. This is a medically supervised weight loss lifestyle wellness program. And once you learn it, in 12 weeks, you just continue and you can lose as much weight.
Yeah, habits become behaviors. And so
Yes.
when you learn these habits and can continue on through the 12 weeks to wellness, it becomes a part of you and easier to sustain that and keep the weight off. So again, Dr. Christie mentioned the website ANWANwellness.com, ANWAN wellness.com, the landing page right there. You see it to sign up, get the information from Dr. Christie, make that one-time initial visit to either Tucker or the Hapeville locations to really kind of get to know Dr. Christie, what the program entails, and get your BIA. Did I say that right? All right. Coming back with a lot more in hour number 2 and talking about some of the aids, the weight loss aids that you're going to experience in the program as well. When we come back, stay tuned. I'm glad you're here on a Sunday. It's Ashley Frasca on the Weekly Checkup on WSB.